people are having sex, and that's okay. And if we can talk about that, if we can address those needs, if we can do it outside of a framing of just disease or just pregnancy, what we're going to do is see people of all different backgrounds, all different ages supported across the life course, whether they're sexually active or not, whether they are choosing to reproduce or not. We can recognize that it's a fundamental part of what makes us human. My work covers everything from sexual well-being and pleasure to sexual behaviors and practices, menopause, the health and well-being of trans and gender diverse people. We know that people have sex because it feels good, it's satisfying, it's a way to feel close to someone. And yet, we've had a really hard time acknowledging that in the health sector and in delivering health services. A couple years ago, we conducted a systematic review and meta-analysis of the sexual and reproductive health service literature to understand whether those interventions that incorporated sexual pleasure, that were willing to acknowledge the reasons people were having sex, whether they outperformed those that didn't. And our research showed pretty categorically that yes, they do. Honestly, there are a lot of gaps in our knowledge. We have focused so long on the needs of women of a reproductive age between 15 to 49 that if you think about where our gaps are, think about our neighbors, our family members who don't fall into that category. So that means that we don't know enough about how sexual health and sexuality evolve after the reproductive years. We haven't focused enough on what the sexual health needs of men are. We could be doing much more to consider the needs of LGBTIQ individuals. We just published research that looked at specific barriers that trans and gender diverse people face when accessing routine sexual and reproductive health services. Things like fertility treatment or contraception or antenatal care. What that really showed us was that it's not just enough to take routine SRHR services and say, let's make sure everyone can access them, but rather we need to take into account specific individuals, including trans and gender diverse folks, and indeed individuals who are part of the LGBTI community more broadly, and make sure that their unique needs and their barriers can be identified and addressed as part of our provision of quality care. So there's a lot that we don't know, and I think if we can take a step back from the traditional focus on disease and reproduction, then we can create a space where we can make sure we're meeting the needs of all individuals across the life course.